Hello everyone, it's yet another weekend whereby we continue bringing you our day-to-day educational bangers. I start by appreciating you people for the continued support you have accorded me, for the subscriptions, for the likes, for the comments, and also I would like to apologize because yesterday I was not able to produce any video because I was a bit held up, but we are going to recover. I don't always produce videos on Sundays, but I will make sure the ones I was to produce yesterday, they'll be premiered tomorrow. So let's continue subscribing, liking and sharing our videos so that they may be recommended all over the world, and our channel will grow bigger and we will continue getting our education, which is benefiting most of us. And I do appreciate because most of you are benefiting from this education, and this is what is keeping me going, making the channel grow. Let's get back to our discussion, whereby we have been dealing with diarrhea, which is a very common disease in our today's life. Today we will be discussing about five most effective diarrhea remedies, all ways to prevent diarrhea occurrence. We have experienced diarrhea bouts in some point in our lives. Nobody can tell me that he or she has never experienced diarrhea since he or she was born. That's why I'm saying we have experienced diarrhea bouts in some point in our lives, be it due to food poisoning or any other cause or any other illness. But the fact is, you have ever experienced diarrhea in your life. Common symptoms of diarrhea include frequent watery stools, abdominal cramping and bloating. The most common symptoms of diarrhea include abdominal cramping, frequent watery stools and bloating. Diarrhea is often your body's way of dealing with disruptions in your gastrointestinal tract. Diarrhea is often your body's way of dealing with the disruptions in your gastrointestinal tract or gastrointestinal system. Acute diarrhea lasts less than 2 weeks. Acute diarrhea lasts less than 2 weeks and can come from many sources as follows. Acute diarrhea lasts less than 2 weeks and can come from many sources as follows. Number 1, it can be due to viral infection. Number 2, it can be due to bacterial infection. And number 3, it can be due to food poisoning. It can be due to recent antibiotic use. It can be due to contaminated water with an infectious agent. Let me repeat this. Acute diarrhea that lasts less than 2 weeks. That means any diarrhea that will last more than 2 weeks will be termed as chronic. But if it's less than 2 weeks, it's acute and can be caused by the following. Number 1, viral infection. Number 2, bacterial infection. Number 3, food poisoning. Number 4, recent antibiotic use. And number 5, contaminated water with an infectious agent. So, infectious diarrhea is common in young children. Get this very clearly. Infectious diarrhea is very common in young children and is often caused by a virus. Infectious diarrhea is common in young children and is most commonly caused by a virus. Traveler's diarrhea can occur if you travel to underdeveloped areas with contaminated water. Traveler's diarrhea can occur if you travel to underdeveloped countries or areas with contaminated water. So the point is, the water should be contaminated for you to have this kind of diarrhea. So, bacteria from improperly stored or improperly cooked foods are typical causes of food poisoning. Let me repeat this one. Diarrhea or bacteria from improperly cooked food or improperly stored food are typical causes of food poisoning. And we talked about this when we were discussing about food poisoning. So, below, all the following are some of the effective ways. If the key word is effective ways to analyze acute diarrhea through the following ways. So, below are some of the effective ways to manage acute diarrhea, and it can be managed through the following. Number one, we have what we call hydration. Obvious, this means replacing the lost fluids which has been lost through diarrhea, and also maybe you may also have vomiting, for example, in the cases of food poisoning. So hydration is very important when you have diarrhea. Hydration or replacement of the lost fluids is very important when you have diarrhea. Dehydration, which comes as a result of diarrhea, can be fatal. Fatal means it can cause death. Dehydration can be fatal in young children and older adults who are experiencing diarrhea. Over-the-counter pediatric hydration solution, for example, Pedialet, are recommended fluids of choice for children and with diarrhea. Over-the-counter pediatric hydration solutions, for example, Pedialet, are recommended fluids of choice for children with diarrhea. Small amounts of hydration solution should be given frequently. Small amounts of hydration solutions should be given frequently. These formulas also come in PepsiCo preparations. Studies show that adults with mild symptoms of diarrhea, sports drink, and over-the-counter rehydration solutions are effective. So if you have mild diarrhea, sports drinks and over-the-counter rehydration solutions are effective. A point to note: alcohol, milk, soda, and other carbonated or caffeinated drinks should not be used for hydration. Very important. Alcohol, milk, soda, and other carbonated or caffeinated drinks should not be used for hydration purposes. This marks the end of our first video today, and in the next video we will continue looking at these 5 most effective ways or remedies of dealing with diarrhea. Let's meet in the next video.